The human mind is one of the greatest mysteries we face. As strange as it is interesting, the human mind always manages to fascinate us. Which is why our mental health is always important. We have to take care of ourselves mentally and physically to prevent problems, such as mental disorders. Most people have heard of mental disorders such as schizophrenia or obsessive-compulsive behavior, usually caused by delirium, dissociative states, overwhelming experiences, and brain abnormalities. These are just a few examples of mental disorders that are known. However, there is a long list of very strange mental disorders that are not well known to the general public. In this video, we present some mental disorders that you may never have heard of, but which affect more individuals than you imagined, probably starting from you. But before we get into it, please subscribe to our channel if you're not, and click that bell to get notified on new videos. Thank you. Capgras Syndrome. People with Capgras Syndrome are firmly convinced that someone close to them has been replaced by an identical imposter, like in the 1978 movie Invasion of the Body Snatchers. This type of delirium is common among schizophrenics, and often those suffering from dementia and epilepsy. But if they're right, we'd all be in big trouble, because I don't remember that movie ending well. 2. Fregoli Syndrome. Capgras Syndrome and Fregoli Syndrome are diametrically opposed psychiatric disorders. In the case of the latter, the patient is convinced that all people around him are in fact the same individual, an individual who can change his physical appearance at will. Okay, this is beginning to sound like a plot for an X-Men movie. Cotard Syndrome. The person affected by Cotard Syndrome has a delusional conviction that he is dead or does not exist. These individuals may have the impression that they are rotten or have lost all their blood and internal organs, but in reality, they're just being ignored so hard that they think they're dead. My mom could do that to you. Cotard syndrome often occurs in those who suffer from other mental disorders, such as psychotic depression or schizophrenia. 4. Reduplicative paramnesia. This mental disorder is categorized by the delusional belief that a certain place has been replicated. Specifically, there are simultaneously two identical copies of the same place. It sounds reasonable. If there could be humans that look exactly alike and accepted as twins, then why can't buildings be the same? For example, the patient may be convinced that the hospital in which he was admitted is a copy of another hospital located elsewhere in the world. These individuals may have the impression that they are in a parallel world. 5. Foreign hand syndrome. Those who suffer from this disorder are convinced that one of their hands does not belong to them. Moreover, it can act on its own. These patients may even believe that they are possessed. In general, people affected by the syndrome of the foreign hand have experienced a lesion in the calyx body, which connects the two cerebral hemispheres. Just think, maybe they sat on their hand for too long. Macropsia or micropsia. Sometimes called Alice in Wonderland syndrome, the neurological disorder is characterized by a disordered perception of images, space, and time. The most serious symptom produced by this order is the alteration of how the patient perceives his own body. The affected person may become confused about the size and shape of his body, which causes fear and panic. This psychiatric disorder is often associated with migraines, brain tumors, drug use, and infections. The most suitable treatment is rest. 7. Jerusalem Syndrome. Jerusalem Syndrome is characterized by the presence of obsessive and delusional ideas related to a religious experience. This order can be triggered by a visit to the capital of Israel. The religion the patient follows does not matter when it comes to the syndrome. The affected people are already suffering from other mental disorders before they visit Jerusalem. The symptoms of Jerusalem disappear within a few days after leaving the city. I just think they could be homesick. 8. Paris Syndrome. Paris Syndrome has been observed among Japanese citizens visiting the capital of France. Some of them experienced nervous breakdowns during the visit. The disorder was also observed in the Japanese visiting other regions of the globe. It seems that Paris Syndrome is an extreme form of cultural shock. It produces physical and emotional symptoms such as anxiety, distortion of perception on reality, delirium, hallucinations, and more. Of the 6 million Japanese who visit Paris every year, about 20 are affected by Paris Syndrome. The suspected triggered factors are the idealization of the destination, the language barrier, physical and mental fatigue, and the confrontation with cultural customs that are totally different from those which the patient is accustomed. I bet they were meeting their in-laws. 9. Dissociative escape. Have you ever walked from your room to the kitchen and then stopped in the middle of the kitchen asking yourself why you're in the kitchen? You're not thirsty or hungry, so why are you here? It doesn't have to be the kitchen or your room. You just find yourself somewhere without knowing why you're there. If yes, you might have what's called dissociative escape. People who experience an episode of dissociative escape begin to walk from one place to another unexpectedly without knowing their own identity and why they are in that particular location. I personally call this disorder, "What's your ambition in life?" In general, episodes of the dissociative disorder are preceded by suffering, periods of intense physical and emotional stress, ingestive of psychopathic drugs, or the existence of certain medical problems. 10. Foreign accent syndrome. Individuals suffering from this mental disorder begin to speak in their mother tongue with a foreign accent. Foreign accent syndromes fall into the category of rare mental disorders. It is usually caused by a major head injury or an injury that affects the brain nuclei responsible for speech. Or it could just be that person is lying he is from Australia when he is really from New Jersey. 11. Stockholm Syndrome. Stockholm Syndrome is one of the most famous mental disorders. The affected people show sympathy and loyalty to someone who abused them. These symptoms have been observed in cases of abduction, rape, spousal abuse, and more. This disorder was named after a famous bank robbery in the Swedish capital in 1973. The hostages became so attached to the robbers that they refused to testify against them. Stockholm Syndrome is one of the most famous mental disorders. 12. Lima Syndrome. Lima Syndrome and Stockholm Syndrome are another pair of diametrically opposed mental disorders. In the case of the first disorder, the victim manages to gain the sympathy of his attacker. He gets to fulfill all his desires and satisfy his needs. This phenomenon may occur because the attacker feels guilty or becomes undecided about the morality of his actions. They call it Lima Syndrome. I call it showing a conscience. Lima Syndrome named after a hostage taking at the Japanese embassy in the Peruvian capital. 13. Stendhal Syndrome. Stendhal syndrome is triggered by the contemplation of a work of art. Symptoms include physical and emotional anxiety, dissociative experiences, confusion, and even hallucinations. Anyone can experience this mental disorder if they admired an extremely beautiful work of art called Jane, or just seen really good art. This disorder can also occur in the case of people overwhelmed by the beauty of nature. In general, the experience is not lasting, and the affected individual needs only a minimum of medical care, which hopefully Jane can provide, especially if you play your cards well. 14. Hoarding, Diogenes Syndrome. One of the most widely publicized mental disorders of recent years, Diogenes Syndrome is characterized by a general state of apathy, neglect of personal appearance, and compulsive need to collect unusable objects like that last date's phone number you will never call. The name of this syndrome comes from the Greek philosopher Diogenes of Sinope, 1412 to 1123 BC. The name is considered to be inappropriate because Diogenes was cynical and minimalist. He believed that the meaning of human existence consists in living a virtuous life and following the laws of nature. He rejected all conventional desires, wealth, power, fame, PlayStation 4, etc. Diogenes lived in a wine barrel on the streets of Athens. He became famous after he behaved insolently towards Alexander the Great during a meeting with the great emperor. Seeing the philosopher's sad condition, Alexander asked him if he could do him a favor. Diogenes, who was relaxing in the sun before the emperor stopped in front of his barrel to talk to him, said briefly, "Take a little step away, block the sun." Either he must have been drunk on his vines, or he had 3 sets of balls. That's all we have for you today. These 14 disorders we have presented in this video are just a few of the many existing mental disorders. Do you have one? Or do you have 7? How do you cope with it? Let us know in the comments, and let's see how we can help each other out. I think mine is 9 and 14. We hope this information has aroused your interest in your mental health and how important your mental health is. Don't forget to subscribe to our channel and give this video a thumbs up. Thank you for watching. Until next time.